As we enter the 5th week of an unprecedented nationwide lockdown, and as we look to the future, we should remember why we are here. Washing our hands frequently with soap and water, and the use of alcohol-based sanitizers. Keeping a distance of more than 1 meter between yourself and the next person, especially those who are coughing and sneezing. I know this is difficult to do, but it is a precaution that we must try and practice. It is important to note that several restrictions will remain in place regardless of the level of alert for as long as the risk of transmission is present.
Well, hello and welcome to Unfiltered on SABC 3 and Channel 404. I'm Desiree Chauke. Coming up in the program, we look at solidarity in a time of COVID-19. National Freedom Day under lockdown as President Cyril Ramaphosa reiterates how the outbreak has revealed the real extent of the inequality in the country that has up to now mostly just been a conversation. Also tonight we continue to look ahead to the easing of some of the lockdown regulations on May the 1st, down from stage 5 to stage 4. What does it all mean for the country's responses and the country's economy? We also have a chat with the Minister of State Security, Minister Ayanda Ndlodlo, about the group of 217 Cuban doctors that arrived in the country today to help curb the spread of COVID-19 and flatten the curve, and what this means for South Africa's relationship with Cuba. Let's now welcome our guests tonight. Later on, it will be Gauteng MEC for Health, Dr. Bandile Masuku, but we also have Lumkile Mondi. He's a senior lecturer at the School of Economics and Business Science at Wits University, and Professor Mariki Venter is the head of the Zoonotic, Abo and Respiratory Virus Research Program at the University of Pretoria. Do join us in this discussion on social media tonight using our hashtags at SABC News Online and SABC News Unfiltered. Our social media question tonight is, will the Cuban medics help flatten the curve of the COVID-19 infections? Let's now join with the Minister of State Security, Minister Ayanda Ndlodlo. A very good evening, and thank you so much for making the time. The doctors have arrived. They haven't even left isolation yet, and there's already a conversation about the motivations for bringing them through. What can you tell us about this process and why it has been necessitated?
Thank you very much, ma'am. We have a problem that is going on around the world of the pandemic itself. And I think no country can claim that it has the experience of dealing with the COVID-19, and all the help that any country can get, it should get, in order for it to be able to ensure that lives are saved and lives are preserved in the manner in which it deals with COVID-19.
Take us through why this is important, because this has been brought up a lot in terms of the relationship between South Africa and Cuba.
Yes, right now the figures do not look too promising, but you must remember that we've started the process of relaxing some of the lockdown rules and the regulations in order for people to go back to work in phases on the one hand, but also in order for us to be able to ramp up production in certain sectors that would have been affected by the lockdown. Now, as we ease the lockdown through the risk-adjusted strategy that has been adopted, you will obviously find a situation where the numbers would increase because people would be interacting more than they have been over the lockdown period. So there is no guarantee that the figures would not go up, the number of deaths would not increase. So this is one of the mitigating measures that government has put in place. You will know that there are field hospitals that have been lined up. We will obviously need more doctors that are going to be able to man these facilities that do not at the present moment have doctors in them, because everybody is either at a private hospital, at a public hospital, or their own practices. So the more doctors we have on board, the better. You will also remember that the president also brought in the South African military health services to also augment what we have in the public healthcare system. So this is no different from bringing in what we have in the military, but augmenting with what the Cuban internationalists have been ready to do in assisting South Africa.
So how do we balance out on the one hand, the deep sense of gratitude that the doctors are here carrying out what has been called their medical diplomacy, and on the other hand, the skeptics?
Well, I do not know what the skeptics are about. If you put measures in place to ensure that people live, people get the necessary treatment and support that they need in a time like this, I would not understand why people would be skeptical. We have got a not so impressive doctor-patient ratio in South Africa, and I think it's a problem that the world is facing right now in this pandemic. Our healthcare systems have been exposed for the weaknesses that they have. And this is not only a South African phenomenon. So if people are coming in South Africa to assist and augment what we have currently, taking into account that there will be more people that are going to be infected, there might be even more deaths that we're going to be experiencing, I would expect that all of us would be happy. I can guarantee you that a patient who will have a doctor that is at their beck and call would not be complaining.
Mr. Mondi, let's welcome you into the conversation. We called you tonight for economic responses, but you're also a social commentator. What are your initial thoughts about the arrival of the Cuban doctors in the country?
I think, as the minister has put it across, that any support you can get to ensure that the negative externality that's been brought by the pandemic can lead to saving us hundreds, if not thousands of lives. It's very important. So as far as that support intervention that the Cubans are offering us, I think it's welcome. We also, given the weaknesses that the minister has highlighted around our health system, our failure to invest in skills and capability, particularly in training nurses, doctors, but also physical infrastructure across our community has been exposed. I think it's one of the lessons that we're learning here, and I think the minister is articulating it very, very well, that at least this pandemic is making us look at ourselves in the mirror and say, after this pandemic, we need to do more around investing on people, investing in infrastructure, so that in South Africa we can also be self-sufficient and not only rely on external people because of our failures to do the right thing, particularly that we knew as early as 1994 that the apartheid regime had investment on infrastructure as well as on people.
What is your analysis, Mr. Mondi, of the risk-adjusted re-evaluation of the country's responses to the COVID-19 outbreak as we look ahead to the 1st of May?
I think, all the teams, from the epidemiologist to the Minister of Health, and I think the whole Command Council, how they've approached this crisis, and by communicating to everyone in South Africa that will embark on risk-adjusted mechanism, that is, ensure that the externality of the pandemic is not only carried by government, but also by corporates. So by the president allowing certain sectors of the economy to go back to work after this month ends, it shows us that the responsibility is not only for government, it's also for corporates and entrepreneurs who are in the sectors that are allowing them to go back to work. However, these entrepreneurs and corporates need to ensure that all the risk management requirements are met, from PPEs to ensuring that they've got testing mechanism so that no employee is affected by the pandemic. And if any mistake, we may move back from 4 to 5. So I think it's the most transparent, most accountable and responsive intervention by the command and broader health as well as broader South African society in dealing with the pandemic.
All right, we're going to let go of Minister Tlotlo before we go to break. But before we let you go, Minister, how do we allay the fears about the evolution, how this process has been handled, questions about these doctors and whether they came through of their own volition, and concerns about human rights in this process?
I don't think South Africa would countenance the violation of human rights of people that are coming into South Africa to assist. We have had a long-standing relationship with Cuba. We also understand the propaganda machinery that has been put in place to place and put Cuba in a very bad light with regards to human rights practices and stuff like that. You must remember that this is a country that has undergone tremendous problems, but at the same time has been one of those countries that has shown that the embargo that has been imposed upon it, albeit illegally, over many, many decades, has not put them in the back foot with regards to certain sectors and certain areas of either the economy, the social, and the cultural aspects of their lives. They have the best education system. They have the best healthcare system. So it would be really foolhardy for countries to be looking at and nitpicking on issues that are propaganda more than they are based on fact, because part of the world has closed itself out and has not let the Cubans in to understand what it is that goes on in that country. That country is open to everybody, but the problem is that the sanctions and the embargo that has been imposed on that country makes it difficult even for those that want to learn about the cultural system, the social system, and the economic system of the Cubans and how it is that they live, has made it difficult for people to have informed decisions and choices about what it is that Cuba is actually about.
Would love to talk to you some more, but we understand you have to go. Thank you so much for your time this evening, Minister Tlotlo. Let's take a break at this time. Stay with us. Unfiltered will continue afterwards.
Some people have been able to endure the coronavirus lockdown in a comfortable home with a fully stocked fridge, with private medical care and online learning for their children. For millions of others, this has been a month of misery, of breadwinners not working, of families struggling to survive, and of children going to bed and waking up hungry. The social relief measures announced last week that are now being implemented are therefore as much about narrowing the gulf of inequality as they are about supporting vulnerable citizens through this trying time.
All right, welcome back, and thanks for staying with us here on Unfiltered. Let's welcome once again Mr. Mondi and take off from the conversation we were having just about the anticipated impacts of this time on the South African economy, and how are we even able to put up forecasts when there is at a time when there's 0% trade in the country.
So our expectations are of a huge drop in our economic growth. Already we're in a recession. We expect us to decline at least, if we're lucky, by about 10% of our GDP. What's been very disappointing is really the magnitude of our intervention. The president announced about 500 billion, and we know that 130 of which was already money committed in the budget. So really, if you look at the extent of the stimulus, despite the figures that have been told that by the Minister of Finance of about 800 billion rand, it is far less than that. I think we still need more. I'm hoping that in phase 3, we'll see more hands being shown by the central bank, because the central bank is the one that I think can also play a much bigger role than played in this crisis. And we want to see more money reaching to the poor, because I think where we're seeing a huge impact is on poverty, on destitution, because we don't have food. So we'd like to see not all the 350 rand amounts to those that are unemployed and not benefiting from UIF, but a much more stronger, because we believe that going forward, we may in fact, if we don't put more money, have more desperation and more destitution as people leave their job. So overall, I think it's very little that we're going to see in terms of impacting people's lives. But maybe we save some companies in terms of the support. But we need more. I think we need more, particularly now we realize that on the social side, we haven't done much. People are trapped, infrastructure is poor, human settlements are poor, no access to water, no access to health facilities. That's the area of the new economy that we'll be investing in going forward.
You're concerned about the figures, and at the weekend, reports came out of the Black Business Council being concerned about procurement of services and where these are going to, and worried that their constituency was not being approached by government in terms of helping out in this fight. But we'll talk about that in a while. But let's bring into the conversation now the MEC for Health, Dr. Bandile Masuku. Dr. Masuku, thank you so much for joining us this evening. We know it's been a long day. On Freedom Day, you were out conducting further tests. Latest numbers we have for Gauteng, 1,331 positive, 8 deaths, 868 recoveries, 13,558 tested. Do you have any new numbers for us?
No, I think we had a good day this afternoon in terms of our testing and screening, and we were concentrating on the area that has got the highest concentration of infected individuals, which is Region E in Johannesburg, which constitutes of Sandton, Wynberg, and Alexandra. The numbers look quite well, and we tested close to 1,400 individuals, which were actually even screened before. So we did quite well for a holiday, and the excitement and the people came out in their numbers.
All right, you're watching Unfiltered. Let's take a break. When we return, we continue our conversation here on Unfiltered.
There's very little difference between the stage 4 and stage 5, but there are things that they might not have been in stage 5 that will be stage 4 that will be very good. One of them is a curfew. We expect nobody at road after 8 until 5 in the morning. There wasn't curfew this time, but there will be curfew this time. That time. And things like restaurants, people won't go there. They'll still serve them and deliver in the houses and all that. We have a very little difference. There'll be no interprovincial movement. That's another problem on this road. Most of the people that we are finding here, they are coming from Limpopo. They are using the backdoor road.
Welcome back, and thanks for staying with us. And of course, as usual, our viewers are part of this conversation. Let's take a look at some of the tweets you've sent through tonight. Nazim Grootboom saying, definitely sure we have seen them help other African countries and around the world. Let's pray for them and stop this deadly virus in South Africa. Of course, that's in relation to the Cuban doctors that arrived today. Mila Pieterse saying, may our local doctors that have been busy with this fight for a while now also get the same recognition that the Cuban doctors, please. How much and who are we paying for their services? These are some of the questions that are being asked. The next one, Itumeleng saying, we can't be certain if they will or will not. Only time will tell. Agree with you there. And Tigers saying, how are they coping with COVID-19 in Cuba so that we know if they can manage in South Africa? All right, we also have a video response for tonight. Let's take a listen to that.
I don't see this helping us that much. Bringing in 217 doctors is very little, while the government can bring in 73,000 soldiers. What are the soldiers here for? It's to kick us, kill us. I don't see it working. And another thing is, the more important is that we need to do this ourselves. People need to obey instructions. We need to do and follow everything. Without that, doctors cannot help us.
Dr. Masuku, let's welcome you back into the conversation. A sense of gratitude, but also a bit of skepticism about the arrival of the Cuban doctors. Are you able to give us some sort of detail about how they will be interacting with the fight against COVID-19, specifically in Gauteng?
I think the strength that they have, particularly in terms of how they do their medicine and how they do their public health, it's how community orientated they are. And they do a lot of preventative work, and also it has got an aspect of education, which when we deal with the COVID-19, you'd realize that besides any other talks that people talk about ventilators and hospital beds and everything, the main aspect of the fight against pandemic is just public health education, which the Cuban have got that strength, and we are going to learn a lot from them. That is their particular strength that they have.
We're also joined on the line by Professor Mariki Venter. She is the head of Zoonotic Abo and Respiratory Virus Research Program at the University of Pretoria. Professor Venter, let's welcome you into the conversation. For all that has been said about the definition of COVID-19 and its impact, what do we know by now, especially in South Africa, about this virus, especially since research processes have gone into overdrive? Do we know anything new than what we knew in December, for argument's sake?
Well, of course, it's a new virus in South Africa. It wasn't here in December at all. So at the moment, our figures is looking much better than in other places, but it's really because I think we took action so quickly. In the rest of the world, this virus has really been associated with quite severe disease, and up to 5% of patients that had fatalities, which is higher than what we saw with normal influenza every year. As you know, mostly elderly patients over the age of 70, up to 15% of them can die. Patients over 60, up to 3% of them die. But then for younger people that are otherwise healthy, in general, they will only have mild disease. And so far, we've seen that in South Africa as well. There are people with underlying disease that have died, that have other lung problems and so on, or chronic disease. Our worry here is, of course, in HIV patients, but because we have so many people on treatment, we hope that they will also have a better chance. But similar to other countries, we haven't seen really children that had severe disease or that died. So our picture is very similar to the rest of the world, but so far our fatality rate has been quite low.
President Cyril Ramaphosa has put a lot of emphasis on evidence-based responses. How is the research space helping government in terms of its responses to this outbreak?
Well, I think there's a coordinated research response at the moment. So we're working closely with the WHO, with the NICD, to make sure that appropriate research is addressed. Of course, at the moment, a high priority in South Africa is to make sure that enough patients get tested so that we can identify cases, trace their contacts, and isolate them. I think the government and the private sector has done quite a good job in rolling out testing. And some of the research has also gone into making sure that the test that's being used is appropriate and of high quality. So, as you know, WHO has coordinated some vaccine trials and antiviral treatment trials, and I think it's important that South Africa is associated with that as well, so that we play an important role as part of solving the bigger problem.
You're watching Unfiltered. Let's take a short break. When we return, we continue our conversation with the MEC for Health in Gauteng, Dr. Masuku, and Mr. Mondi in terms of the economic recovery of the country, and Professor Mariki Venter. Stay with us for that.
Your mission in South Africa is going to be a difficult one, a complex one. You will be fighting every day against an invisible enemy, a very destructive enemy. And you will have to do so without your families, without your friends.
We know you are not the first brigade. You will not be the last one. You've been in the African continent for time immemorial.
We thank each and every one of the Cuban health professionals who are part of this team for their personal commitment and sacrifice in order to assist South Africa's efforts to curb COVID-19.
When we were fighting for freedom, they were with us. When we were fighting Ebola in West Africa, the Cubans were there with us.
Many big capitalist countries are failing even to confront this invisible enemy as the Cubans are actually doing.
Well, welcome back, and we continue with this conversation. Let's bring back our guests again, the MEC for Health in Gauteng, Dr. Bandile Masuku. Dr. Masuku, for a while now, the Minister of Health has been saying it will get worse before it gets better. But there's a sense of uneasiness now as we approach the 1st of May and embark on level 4, that the numbers are really exponentially going up now. Do you get that sense as well?
Yeah, I think the most important thing that we worry about is the community spread, and we have to be able to get ahead of it, and that's the worry about it. So for Gauteng, one thing that is a bit is that the movement between provinces will still be restricted, and the OR Tambo airport will still remain closed. And we are hoping that will still help us a lot in terms of making sure we're able to track and trace everybody. Though we know that just lifting up certain areas, certain districts in Gauteng might give us a big challenge. Our challenge is to be able to get a whole lot of regulations in terms of restrictions in Johannesburg, Ekurhuleni, and partly Tshwane, because those are areas that have got high numbers. And we are becoming more anxious as we look at it, as you say it correctly, with the lifting up of the lockdown. But we're hoping that the restrictions that will remain will give us the positive outcomes.
Well, as it happens usually during Unfiltered on Monday nights, the Minister of Health will release the latest figures. When I started the conversation with Dr. Masuku, I was talking about 1,331 positive cases in Gauteng. The minister's just tweeted the latest figures. Gauteng is sitting at 1,353. The Western Cape, 1,737. The Eastern Cape, 902, and the Free State at 111. Limpopo sitting at 31, the Northwest at 28, and it's a bit of a fuzzy picture, but I'll try my best. Mpumalanga sitting at 26, and the Northern Cape at 17, and unallocated cases still at 0. Those are your latest numbers of infections in the country. Mr. Mondi, let's bring you back into this conversation. You've been listening to what the MEC has to say. And KwaZulu-Natal has said that eThekwini might have to stay at level 5. Is it a good idea to move towards level 4?
It's a huge risk that the country is taking. Dr. Masuku knows that we've got a huge challenge around the commuter the transport system. We know that with taxis, we restricted the number of people that can travel. However, that will require a lot of discipline because we're expecting just over 1 million people to go back to work in the next few days. Therefore, if you include the trains, we just worry that we're not going to be able to have a lot of physical distancing. And that might, in fact, increase the number of infections and in the process, at least have to go back to stage 5. So I think we're taking a gamble because of the pressure that they've been exerted on our government, particularly by another group that argues that there was no need for lockdown. So let's see what plays out in the next few days when we go back. But I am very worried that the collapse of PRASA and the corruption that came with it, the lack of regulation of implementing the tax renewal plan that we had earlier on in our democracy, and the failure of government to provide universal transport system is going to be affected tremendously by this pandemic and expose our government. And I'm worried that we may go back very quickly to stage 5. Yes, I think to that end is correct. I think even after Gauteng, he takes the risk that we could go back to stage 5 because of the challenges that are happening.
Professor Venter, let's bring you back into the conversation here. Dr. Masuku was out conducting tests tonight, and the 1.2 million people screened for the virus in Gauteng in terms of the screening, but lesser numbers tested. Let's talk about the differences between the screening and the testing and how one is then considered a testing candidate as opposed to a screening candidate.
Well, in order to identify patients, of course, you will first just look at the clinical signs and see if we identify patients that fits the case definition of COVID-19. So apart from also having to look at some asymptomatic patients, of course, initially we're trying to find those that we can see have the correct clinical signs, and they will then be selected to be tested. The actual test that is used is called the polymerase chain reaction, or PCR test. This tests directly for the nucleic acids or the RNA of the virus, and these are very specific tests to identify the virus. So it's very important that these tests are done the same type of test through the country in the private and in the public sector. And at the moment, I think it is done quite successfully and being rolled out countrywide. So, of course, our numbers are going up because we've also increased the number of testing. So it's also a good sign to be able to identify and to be able to show that we do find the cases that we are looking for.
Dr. Masuku, let's speak to you again. As we look ahead to the 1st of May once again, what can you say to the residents of Gauteng about how to approach this time?
Yeah, I think the most important aspect is just to continue to maintain the restriction regulation, particularly just to maintain, what we call the golden rule, of hygiene in terms of washing hands and actually disinfecting all the surfaces and also the cough etiquette. Because even if we use masks in the public spaces, which will be mandatory now when you go out into public, it will also help us to protect others, those who are not infected. So, as we have said before, we don't create or respond like China did or South Korea did. We want to create a South African response, and one of them is just to create a hybrid of many actually measures that have been put in place. So the mask being mandatory in public will also help us in instances where you can't afford or you can't have social distancing. But the basic hygiene, etiquettes and habits are supposed to be maintained. And we just hope that part of it is that the curfew must be respected, as it is. The regulation on alcohol is also, actually quite important in that regard. So basically, we just want to continue with the message, and we are hoping that it will be amplified as we go forward, and we are going to learn a whole lot from the public health strategy that comes from the cohort that comes from Cuba.
You speak about a hybrid of responses, and I totally understand this might not be your area, but a lot of our viewers are concerned about the lack of detail in terms of the role of the public, especially the indigent sectors of our public that really need the social responses that the president has announced. People are worried about the lack of detail in terms of how to access these and who qualifies and that kind of detail. When can we expect this detail to come out?
The detail is going to come out, and it will be outlined by provinces and also by the ministers responsible. I think the Minister of Finance will be making an address tomorrow to the public to actually outline how some of the measures and some of the interventions that government has put into place and how people can be able to access them. But those are the important aspects, because one thing that we have also realized that some of the measures that we have spoken about that we have actually implemented, they are not easily implemented in most of our areas in Gauteng, particularly those areas of highly densely populated spaces. But we are hoping that the ministers and also as a province will also outline some of the few interventions that we are going to make in the economic space.
Mr. Mondi, you spoke about the inadequacy of the 500 billion that was announced by the president. As we approach the 1st of May and there aren't sufficient resources, what role can the public play in playing their part in this fight against COVID-19 where the government is lacking?
South Africans have been amazing, particularly in terms of mobilizing food and ensuring that they can send it to churches, to NGOs that have been distributing food, or pledge certain amount of cash that could be sent to those that are vulnerable. So that reliance continues. I don't think that's going to stop in view of government failure. So really, the lack of institutional arrangement that can get to the bottom of many people, particularly informal settlements, is a huge challenge for, I think, the South African government. But also the requirements that are being put by the Minister of Finance, for example, about in the spouses, where we expect spouses to register with the South African tax revenue as well as be compliant, when in fact they were pushed to the margin by an economy that did not allow them to be part of the broader economy, and yet expect them to comply in an epidemic and an emergency. I think it's just too much to ask for those small and micro survival businesses. Therefore, that area, I'm hoping that Dr. Masudu mentioned, that the Minister of Finance relaxes that, because simply we want the cash to reach out to those that are supposed to reach, whether it's the micro businesses or it's individuals. Putting in a lot of restraint and mechanism, it just not frustrate the process and put people to destitution and famine eventually. So we need a lot of innovativeness and a lot of tolerance. That the main idea is to maintain lives. Secondly, to ensure that no one starves in this process by making sure that cash reaches those that require it, that we can maintain some stability in those communities that are struggling due to the pandemic, but also to the mismanagement of economy in the past years, because we have not created jobs, the infrastructure has been poor, and it continues to be exposed now when there's a pandemic.
Stay with us. We'll be back after this break.
The issue of the social distancing, it's what actually worries us, especially in the shopping malls. And we are in the eastern district in Metro, which is part of the city of Cape Town, where we have seen actually quite a number of cases, and mostly coming from the shopping mall. So that's why it's important to create awareness and educate the community.
We need to thoroughly investigate how did it happen that a private hospital that always says they have the best equipment, best protocols, finds itself with more than 71 health workers that have been infected.
We've been locking down all the areas where we have seen the outbreak, whether you talk about Port St. John's, whether you talk about Nelson Mandela Bay, whether you talk about prison here in Buffalo City, East London, in ensuring that we screen and test everyone.
The case that happened here in Lipelenkumpi of unfortunate incident where we lost a 69-year-old here, what the family has been going through, what the wife has been going through, it's not something that is desirable. It's a woman who has been mourning her husband. Besides mourning her husband, she has just been told that we have tested positive. And the stories that we hear, even other political parties issuing a press statement, it's really uncalled for.
Just looking there at some of the work that the different provincial MECs have been putting in terms of this fight against COVID-19. But let's also look at your tweets at this moment, some of your contribution to our conversation. Zora saying the Cubans are experienced in primary health care. We don't have enough doctors who specialize in PHC. Our health system is mainly curated. I don't know what that means. The Italians and other countries have called on Cubans for this reason. Their health skills are 100%. Right, let's take a look at another one. I hope Heroes welcome of Cuban doctors does not send discouraging messages to our medical professionals who've been doing exceptionally well, and trust will continue with that. #Cuban. Major General saying when Cuba sent its troops to fight in Angola, in Namibia, in Zimbabwe and South Africa in support of the ANC, we never complained about jobs. Now Cuban doctors are here to help fighting COVID-19, and some might not make it back home. But Africans are already complaining about Cuban doctors taking jobs. #Cuba in South Africa. And Khao saying the Cuban doctors that came are specialists and there's much needed competency required in the fight against COVID-19. Those are your thoughts tonight. MEC Masuku, what are curative doctors? Did you hear one of those comments?
Yes, I think that's how our Western medicine essentially has been described to be, that we only concentrate on curing rather than preventing disease. And I think when we, like I said earlier on, when we speak about the fight against the pandemic, the major work that we need to do is about public health education, which deals with preventative measures. And these are the ones that we have been talking about. And the Cubans, in terms of their healthcare system, which is mainly based on that part of preventative healthcare, which is something that we need to do. And as we have been discussing NHI, universal health coverage, before the pandemic, one of the things about NHI is just to restructure and reshape our healthcare system to be more on the preventative side of things, because we know prevention is better than cure, and prevention is cheaper than when a person is already in hospital. And from the fight against the COVID-19, we see that aspect of it, that when we have to deal with patients that are already in hospital, then it becomes more expensive for us as a healthcare system.
So, MEC, as we wind down our conversation, the lockdown is in place to slow the progression of the outbreak and not necessarily to eradicate it. And talk of a vaccine only being a year away. Realistically speaking, how long are we going to be under these conditions?
I think we need to be ready for a long haul. It's not something that is going to go away in a short space of time, and it's just one thing that we need to look at as an opportunity to do a lot of things differently as a country, in even how to restructure the economy, to make sure that efficiency comes in and we are able to build up new cohort of workers and professions that are there. And I think it's almost like a reset button, and we are in for a long haul. It could be a year to two, but it means that we need to be able to create a space for the healthcare system to be able to cope with the numbers of those who are infected. At the current moment, the lockdown has given us a positive impact in terms of slowing it down slightly. Continuing forward, we need to continue to slow it down and make more other people and make that the healthcare system itself in South Africa is able to cater and be able to deal with those who are infected at that particular time. And I think that's what we need to be ready for.
MEC Masuku, let's thank you for your time this evening.
Thank you so much.
Mr. Mondi, just to finalize our conversation, in a world of the economy, we talk about risks and opportunities. You heard the MEC there saying that we might have to look at new kinds of opportunities and ways of doing things. What springs in mind for you in terms of new opportunities that might come out of this crisis?
Firstly, if you allow me, I just want to say that the MEC, Dr. Masuku, is spot on when he says we're in this for a long haul. However, I may ask his government, why are they then giving the social support only for 6 months when they know exactly that we're in this for a long haul? Why aren't we thinking about a basic income grant for all South Africans? Because we know we're in this for a long haul. So I'm quite worried that a lot of people then are going to be left behind when we know we have information that we're in this for a long haul. When you look then at the new economy, we think the new economy should be focused on inclusiveness. That is, firstly, building an economy that will address our poverty of infrastructure, both housing, water, electricity, as well as a broader reindustrialization of our economy, because we have relied very much on Chinese, one of our partners, imports, because we thought they were cheap. So we may need to really protect some of our industries in doing so. But more important, we've seen many of us are working from home now. So there's a migration in higher education, for example, where we're able to use ICT infrastructure to educate and empower some of our learners. At the same time, there are still challenges in an economy that has got a low skill such as ours. So that is where we're going to have challenges, and that is why we may have to have a universal income grant for those that will never be affected by the economy.
Pertinent questions, and we hope the government is listening and will respond. But thank you so much for your time this evening, Mr. Mondi.
Thank you so much.
Professor Venter, let's end off with you. The MEC saying there we're in this for the long haul. How can we make use of research to make sure that we keep up to speed with events and especially use it to improve the space for treatment?
Well, I think it's important to tailor our research to be specific for our population. There's, of course, differences in South Africa to what we will find in Europe. It's important that we are actually entering the flu season now. And one of the things that I really wanted to bring under the attention of the public is that it's really important that we try to get the flu vaccine now, so that we don't think that we have COVID-19 symptoms and then go to the doctor and then be exposed potentially to COVID-19 patients, and in that way saturate the medical system, which is we've been trying to do by flattening the curve. So it will also enable us to determine what our population or how we react to this virus, and how will co-infections, if you get the influenza and COVID-19 co-infection, how will that worsen the situation for us? So it's important to try to reduce that risk. And when we then involve in research to make sure that we're in the front line of getting the vaccines here that we need, and also have appropriate treatment that's well researched and safe for us as well.
Let's thank you so much for your contribution this evening.
Okay, thank you.
Professor Venter there. Let's also thank our other guests, State Security Minister Ayanda Dlodlo, MEC for Health in Gauteng, Dr. Bandile Masuku, and economist Mr. Lumkile Mondi. That's it for tonight. Thank you so much for watching. It's my last program tonight. Thank you so much for the support throughout the last year. It's really been fun. Thank you. Bye-bye.